Good afternoon, everyone. My name is Pariza Fazal. I'm a student at the University of Calgary, and today I'll be talking about my independent research for my psychology undergrad, which was focused on communication between same-sex friendships during the COVID-19 pandemic. We'll start with some background. The COVID-19 pandemic has forced many friendships to transition from face-to-face to virtual communication. This may possibly result in changing communication patterns and the development of new talk strategies and maintenance behaviors. Research has been done on face-to-face to long-distance relationships, but there is minimal research on the effect that a pandemic might have on communication. The current study examines the effect of the pandemic on communication within same-sex friendships, specifically looking at changes that occurred in verbal communication, nonverbal communication, and conversational style. Moving on to the methods. Our study looked at differences in communication and relationship dynamics in university students. This was done in two phases, both quantitative and qualitative. Participants in the study were in friendships that survived the initial lockdown and first waves of the pandemic. For Phase 1, approximately 200 students completed a survey that measured aspects of communication within platonic relationships over the course of the pandemic. In Phase 2, 14 people from this cohort completed semi-structured interviews via Zoom. Quantitative data was analyzed using independent t-tests and Pearson's correlation analyses. Qualitative data was transcribed and analyzed using thematic analysis. Now we'll dive into the results. In accordance with previous literature, friendships that had a change in medium had some changes in their aspects of nonverbal communication and conversational style. However, participants indicated that they missed nonverbal communication, but it was not needed to retain intimacy in close friendships. Individuals in close friendships had higher self-disclosure and were more satisfied because of the unspoken boundaries and maintenance behaviors they had in place. Maintenance behaviors were both conscious and unconscious, and consisted of mental health check-ins, humor, acts of service, and frequent communication. The frequency of the communication between the dyads affected all aspects of their verbal communication. However, it seemed that participants had fewer conversational topics to discuss because of the decreased number of activities to engage in. Although the breadth of the conversations was limited, participants continued to engage in the interactions. The majority of the participants felt that balance was the key to a thriving friendship. This consisted of an equal amount of talking, listening, and engagement from both ends of the dynamic. Now we move on to the discussion. Friendships and intimate partner relationships are vital to maintaining positive mental health and emotional well-being. Many of the individuals were engaged in healthy communication strategies and relationship maintenance behaviors that buffered their friendships during the transition from face-to-face to virtual communication. Strengthening communication skills among youth may counteract social isolation and loneliness. It may also help sustain mental health, especially during stressful times. Thank you for listening.